Hello, I'm Dr. Claudine Dufresne, faculty here at University of St. Thomas School of Nursing. I'm here today to demonstrate to you our approved method of inserting an IV into a patient. Okay, I've already verified the order. I've verified the patient by checking name and birth date and verifying with the patient as well, and instructing the patient on the reason for the IV in the first place. So I've gotten the patient's permission to move forward. I've got all my supplies, and I've washed my hands. I've got all my supplies, I'm ready to go. And so now what I want to do is assess for a site on the patient's arm where I will insert the IV. And what I want to do is look for the most distal site. I typically look in the hands. The model we have here, it will have to be on the arm, but you want to start at the most distal site first in case the IV goes bad and you have to move further up. So I've made sure I've located my site, and before I put my gloves on, I'm just going to open everything and get it ready. Make sure that I've got all my materials. And this is a clean procedure, however, I want to make sure that everything stays clean for the patient. Okay. So I'm just going to get one small piece of tape ready and just put it in the packet where I can retrieve it quickly. So I'm going to put on my gloves. And as I said, these are clean gloves. Okay. Prepare the tourniquet. And I want to place the tourniquet at least 4 inches above where I want to attempt the insertion. So what I'm going to do first is I'm going to tighten the tourniquet, and it needs to be tight so that the vein will protrude up. I'm going to palpate, locate where I want to start the IV, and then release the tourniquet, because you do not want to leave that tourniquet tied for any longer than necessary. And then remove the little ChloraPrep. And then clean the area in a circular motion. And it's the friction that is going to clean that area. And typically what you can do is you need to leave this area dry on the patient. And typically what I'll do is while the area is drying, I'm setting everything else up. So I will open the IV catheter. And we want to make sure that the IV catheter, that the cannula on that catheter is the correct size to fit into that vein. We don't want to go too small for an adult, but we want to make sure that we're not going too large. Have it ready. And then for the extension set, I want to attach an extension set to the IV so that I can access it for fluids, medication. Loosen the tip a little bit, and then flush through over. You can just hold it over a trash can and just flush through to make sure that there's no air in the tubing. Okay, and then I'm going to place it in here, easily accessible. Okay, so now the patient's arm is dry. I'm going to reapply the tourniquet. Okay. Do not palpate again. Let it come up, because if I palpate, what have I just done to that site? Okay, so leaving it as is, anchoring the vein. Okay, once I've got the vein anchored down, I'm going to make sure and look at my catheter you want the bevel, which is the little opening in the needle, to be facing up. So we're going to go at an angle where I'm not going to rub this white cannula on my glove, and just go in. Once I get into the vein, watch for the flashback of blood, and there we go. And once I see it, I can advance it just a little more to keep it in the vein, and then thread that needle. Okay, once it's threaded all the way in, release the tourniquet, press the button, and then the patient can bleed just a little, but do not put your finger on the insertion site. I've got it connected. This little piece of tape that I cut, initially what I want to do is I'm just going to secure out here so that it doesn't move while I'm finishing up. Because if the patient bleeds a little bit, I want to be able to wipe them up, put it aside, take the tegaderm that comes with the IV Start kit and tape directly over the site. Nothing else, and smooth it out. Okay? And once I do that and have the site covered, I can remove my gloves so that I can have a better handle on things. Okay? Discard it in the proper receptacle. Retract the syringe, make sure I'm still in the vein, flush it through. Make sure that there's no problem along the vein, and then clamp this. Then once I remove the outer covering, we need to indicate when it was started. So I put my initials on here, today's date. The gauge is a 22 gauge, and the time is 9:15. So that I can follow facility protocol on when to rotate the site on this IV. Okay, so I put it out of the way. Then what I'm going to do is take extra tape, so that I can secure the extension set. To the patient so that it does not get pulled. Okay, and then get rid of everything in its proper receptacle. Now I've had an order to discontinue the IV on the patient. So I'm coming into the room with a pair of gloves, Band-Aid, and a small gauze sponge, just in case the patient bleeds a little. So I'm going to just open it up and instruct the patient that it will just take a couple of minutes to get this done, but then I'm removing the IV. Have them open so that I can get to them easily. And depending on how well they're taped, you want to be very careful not to pull skin when you're pulling the tape. You don't have to go extremely slow, but you want to make sure you're not pulling skin, because many of the patients have impaired skin integrity, and so it's going to be hard for them. So what you do, you just pull, hold it steady, and you can just pull it off. Okay, take the gauze, hold pressure, you remove the cannula, and what you want to do when you remove it is you want to assess it. Make sure that the cannula is intact, so that when you document the removal, you're saying that the cannula was intact. And then it'll be discarded in the trash. You make sure that the patient is no longer bleeding. You can remove this. Get the Band-Aid. And then apply it over the site.